rules we had when we put this program together is that we couldn't have any session without a flavivirus. So, in order to put the stake in the ground for the flavivirus for the afternoon oral presentations, Erin Mordecai is going to come up and talk about the effects of temperature on Zika, dengue, and chikungunya transmission by Aedes aegypti and Aedes albopictus. Erin.
Okay, thank you so much for the opportunity to come and speak, and thanks to those of you who stuck it out for the afternoon. I also want to acknowledge the Center for Innovation in Global Health for the seed grant that they provided to myself and Desiree last year during that program. We also want to acknowledge the Woods Institute for the Environment, which is now funding this work, and the National Science Foundation. So we've been really fortunate with funding. So yeah, I'm the flavivirus person for this session. We had some really good introductions for those of you that were around this morning from Desiree and from Mark, talking about Zika and dengue and what a big problem these viruses are around the world. I'll introduce you to it a little bit more, although I'm sure you've all heard about this problem. Particularly in the Americas, we've had this huge outbreak of Aedes aegypti transmitted viruses, flaviviruses and also an alpha virus, chikungunya. In the case of Zika, this is our current big problem. Of course, it's been linked to complications with pregnancy, most prominently microcephaly, but also lots of other complications in fetuses for when the mothers were infected during pregnancy. So we've had over 1,600 documented cases of Zika-linked microcephaly and over 700,000 cases of Zika in the Americas just in the last year. So this is a really massive problem that we have, particularly in the Americas, but spreading throughout the global tropics. In tandem with this, just in the last year, in the same period, we've had 1.8 million chikungunya cases and 5.2 million dengue cases. So really, really big arbovirus problems. And there's a common culprit here, and it's this little Aedes aegypti mosquito that Desiree told us all about this morning. So there are many different causes for these big emerging epidemics, and it's not just a single factor, although people have tried to attribute it to a single factor like El Nino or climate change. But what I would argue, and this is a figure that was produced actually from a class that I taught last spring, where we examined the causes of the epidemic of Zika, and we tried to point at different aspects of global change that might be influencing this epidemic. And the way we kind of tended to think about it is sort of this filter model. So lots of different things have to happen at the same time to have a big epidemic like this. You have to have lots of mosquitoes that are competent at transmitting a virus. You have to have lots of susceptible people. They have to be exposed to a lot of mosquito bites. And those mosquitoes have to be really efficient at transmitting the virus. So sort of the top level of the framework is the climate even suitable for the mosquito that transmits the virus? And then how many mosquitoes are there? How many humans are they exposed to? How susceptible are those people? And then ultimately, what are the individual level aspects that determine the outcome, the disease outcome for people? So for today, I'm going to focus on just this top level of climate suitability for the mosquito. Because at the very least, if you don't have climate suitability for transmission, you won't see local transmission. Asterisk, except sexual transmission. But we're focusing on vector transmission here today. So what I'm going to ask is how temperature affects transmission of Zika, dengue, and chikungunya. This is important for predicting when and where we might see outbreaks, and for predicting where we might see anomalous suitability for outbreaks, and also for predicting responses to climate change. I'm recovering from a cold here, sorry. So we're going to focus on these two culprits, Aedes aegypti and albopictus, the most common vector species throughout the tropics. Now, we know the processes that control vector transmission from the mosquito perspective. There are things like biting rate, how many mosquitoes there are, how long they survive, how competent they are at transmitting the viruses, how long it takes for the virus to incubate within the mosquito and become infectious, and how long it takes people to recover once they're infected. So there are some really classic mathematical models. I'm going to introduce you to one right here. This is a formula for R0 that basically describes the invasion growth rate of a disease into a novel population, which is essentially what happened here in the Americas with Zika recently. The only thing I want you to know about this equation is that it's a nonlinear function of all these mosquito and parasite traits. These traits, everything except human recovery, are taking place within the body of a mosquito, which is small-bodied and cold-blooded, so we expect them all to be temperature sensitive. So the way that we can understand temperature-sensitive transmission is by thinking about how temperature affects the mosquito and parasite traits. Now, ecologists have done a whole lot of work on this, and there's theory and empirical work across a whole variety of ectotherm taxa that basically says that thermal responses look like this. Excuse me. So almost every trait that we look at, you see an increase from a critical thermal minimum, where the trait goes to 0, up to an optimum, and then a steep decline. Sometimes this is more or less symmetric, but we always see this unimodal response, where there's an optimum peak temperature for transmission where the trait peaks. So what we can do is we can estimate the responses of these traits in mosquitoes in the lab, and then put those into a model that predicts the temperature sensitivity of transmission, which we can test by looking at when and where people actually get infected in the field. So our approach is simply to take lab experiments where people have measured temperature-sensitive traits, combine those traits into a model for R0 as a function of temperature, and then test that against field data where people have reported human cases. So this is an example of what our results look like. This is Aedes albopictus fecundity as a function of temperature measured in the lab, and we see exactly that hump-shaped response that we would predict from ecological theory. I'm not going to go through each of these traits, but what you can see is that they all have that hump-shaped thermal response, exactly as we would expect. Aedes aegypti basically does the same thing. You have these hump-shaped thermal responses that we can easily measure from lab data. So now we put all this into our R0 model, and we get an overall relationship between R0 and temperature. Again, this is the invasion growth rate of a disease, so the rate of spread as it's invading a new population. And basically what we predict is that for Aedes albopictus, transmission peaks around 26 degrees Celsius, and for Aedes aegypti, it peaks around 29 degrees Celsius. And we see both of those transmission rates declining to 0 at temperatures around 18 degrees Celsius, and again, around 34 for Aedes aegypti, and a little bit lower temperature, closer to 32 for Aedes albopictus. So then we were interested in validating this model prediction. Can we actually accurately predict when and where we did see transmission? And it turns out that this is a really hard problem, because in addition to temperature varying in the field, of course, everything else varies, all these really important human factors that people have been talking about all day. So our approach to trying to understand temperature sensitivity was to try to isolate whether the temperature in a country correlated with the probability that we saw an outbreak in that country in a given week, and if we did see an outbreak, how large that outbreak was, so how high the incidence was. So we're basically using our R0 model derived from lab data to see if we can predict where people actually get infected in the field. So here's what we found, and this is at the country scale across the Americas. On the x-axis, we have the probability that R0 is greater than 0. In other words, the probability that transmission is not excluded by temperature, that transmission is possible based on our model, times the size of the population. Because you basically need to have an overlap of susceptible people and highly suitable climate conditions. And the higher that index was, the higher the probability that we actually saw an epidemic. Now what you see in blue is for dengue, and in red is for chikungunya and Zika. So what this is showing is that chikungunya and Zika were less likely to have an outbreak given equally suitable conditions than dengue. And that's because dengue is just more well established in the Americas so far. Now, if we zoom in on those places that actually did have an outbreak, how high was the incidence? And does the model also predict that? So here what we're showing is the predicted magnitude of R0, the predicted magnitude of transmission times the population size, because again, those larger populations have greater opportunities for large outbreaks. And again, what we see is that this model does a pretty good job of predicting how high incidence actually was at this very coarse scale. Remember, we're looking at the country scale for both dengue and then chikungunya and Zika. So we took this as evidence that our model was doing a pretty good job of predicting when and where we saw transmission and where we didn't. And if we see transmission, how much transmission are we seeing? So of course, this ignores the human dimension of things, and we did a little bit of additional modeling that I don't have time to talk about, but of course all of us know that urban population density, socioeconomic conditions, human behavior, reliable access to water, all these sorts of really important human factors are going to play a role too. So again, temperature is only sort of the baseline factor that shapes whether or not it's even possible to have mosquito transmission. And then beyond that, we have to zoom in and look at those human factors on the ground. But nonetheless, we're going to use our temperature model to forecast where in the Americas could we have outbreaks given just the temperature. And so what I'm showing here is the number of months out of the year where temperatures are suitable for transmission. For albopictus on the left and aegypti on the right. And basically what we see is not too surprising. Throughout the tropics and subtropics, temperatures are suitable for transmission for most, if not all, of the year. And then as we move towards the temperate zones, we see less and less suitability, up to the point that it's basically only suitable in the summer, throughout most of North America, for example. What I'm showing in black is kind of the CDC best estimate of where the mosquito species are actually occurring in the United States. We don't have that estimate for the rest of the continent. So of course, we're not going to see any transmission in places that don't even have the mosquito. But at least we're predicting that temperatures are suitable for the mosquito a little bit further north than where it actually occurs. But only for a month or two, maybe 3 months out of the summer. So risk is really limited here. So our model, importantly, would predict that we have a really high suitability for transmission in South Florida, places like Miami, and in border regions of Texas, as well as Hawaii. And these are all places where we have actually seen transmission in the United States, whereas we would predict much more limited risk of transmission in other parts of the country. So it gives us sort of a baseline estimate of suitability. So the key advances that we're making, because of course we're not the first or only people to ask this question about temperature suitability. First of all, we're incorporating mechanism because we're thinking about why temperature affects transmission, because of its effects on the mosquito and virus traits. We're also incorporating those nonlinear thermal responses, which a surprising number of previous models do not incorporate, even though they're ubiquitous. Our model is built with experimental data, so it really allows us to say what the temperature sensitivity is more specifically, and it's validated with human case data, which is a really difficult but really important part of the process. Finally, the model is really transparent and reproducible, we like to think. There's a big issue in this area where when we have a new outbreak of disease, we often see a model put out in Science immediately, 2 weeks later, and there's never any follow-up on did that model actually accurately predict anything, and the model isn't publicly available, so it's not easy to evaluate why these models are predicting what they're predicting. So this new level of transparency and reproducibility is really important. So to summarize the conclusions, temperature does predict transmission risk for Zika, dengue, and chikungunya based on their shared mosquito. They peak at 26 to 29 degrees Celsius, and the permissible conditions are between about 23 and 32 degrees Celsius. Of course, human activities are going to determine your actual risk, what kind of housing you live in, whether you're protecting yourself from mosquitoes, and so on. So with that, I'd be happy to take any questions. Thank you.
I've certainly noticed, Erin, this phenomenon you describe of the outbreak du jour with a sudden model. And, looking back on some of these papers 12, 18 months ago, I almost feel like there's editorial malpractice.
I would agree.
And can you talk a little bit about how we as an academic community can leverage this huge power that models have to help us understand what's going on, and yet at the same time have enough attention to the validity concerns so that it's not just publications running amok? Mm-hmm.
Yeah, that's a really great question, and something that consumes a lot of my mind is how we should deal with this as a field. Because of course, I wouldn't argue, it's very important to have an initial prediction right away, and it's great that people can churn out a model quickly that tells us something in the face of a really unknown epidemic. On the other hand, we also need to be able to revisit those early models and do something to really ask whether they're accurately predicting anything and whether we can update them with new information. So I want to talk a little bit about the gold standard for this that actually the CDC in Puerto Rico has instituted. They had a dengue forecasting challenge in the summer of 2015, which I think this kind of thing should be replicated for every disease. Because basically what they did, they had these 2 data sets of 15 plus years of dengue serotype data, beautiful dengue data over time. And they basically said, anyone who wants can participate. You can download these data, you can make a model and submit it to us, and it's a contest to see whose model can do the best job forecasting dengue dynamics. Then, after you've submitted your model, we'll release a little bit more data, and we'll test the models, and we'll actually see which ones perform best. And then we'll invite those competitors to come to DC and explain their models. So we participated in this contest, and our model was selected to go. Interestingly, ours was the most simple model and was one of the top performers, which was interesting. And what's nice is basically then you're able to quantitatively compare model performance. You're able to draw what works and what doesn't work from different models, potentially even reach a level of ensemble modeling, like what's done in climate change modeling. So this is kind of the way forward, I think. Now, a little bit depressingly, what we found is that this temperature-dependent model, if we wanted to do a mechanistic model, it does a pretty good job of forecasting, but it tends to miss these really big epidemics over time in dengue. And actually, we can do much better with a machine learning model that takes basically no biology and just learns from the patterns in the data. But of course, to do that, you have to have a whole lot of data to learn from. So I think it would be really nice to start to see more collaboration among scientists and more sharing of models and sharing of standardized data sets that we could all use to confront our models and see if we can together improve the modeling. Any other questions? All right, well, thank you very much.